Welcome to our session. It is an all-women panel, so I'm very excited to be a part of this. I'd like to preface this by introducing myself first. My name is Amelia Yachya, and I'll be your moderator for this session. And I'm a former news anchor for CNN Indonesia and correspondent for CNN International. And I'm now based in Singapore. And I'd like to first extend our profound gratitude and sincere thanks to everyone for your participation and for your attendance here today. I'm indeed incredibly honored to be a part of this conference, especially with a crowd of your caliber. So, ladies and gentlemen, today we're going to be talking about an array of topics surrounding women's push for transformation and also delve into great dialogues on the future of sustainable development goals, on sustainability, disaster risk reduction, as well as the much messages that our speakers would like to convey. So as you can see, I have an incredible list of speakers here with me today. Four humanitarian assistance as well as sustainability. Please allow me to introduce you to Professor Tan Sri Dr. Jamila Mahmud. She's the Executive Director of Sunway for Planetary Health Malaysia and the former Senior Advisor on Public Health for the Prime Minister of Malaysia. She's also the former Under-Secretary General of IFRC and the Chief of World Humanitarian Summit and former Chief of UNFPA Humanitarian Branch and founder of Mercy Malaysia. Ibu, we're so incredibly honored to have you here. Thank you. And we also have in our panel, Ibu Adelina Kamal. She's the Associate Senior Fellow of ASEA's Yusuf Ishak Institute, and she's also the former Executive Director of ASEAN Humanitarian Assistance, or AHA Center. Us in Indonesia are very familiar with Ibu Adelina. We see her on TV all the time. We interview her all the time, Ibu. So we're very happy to have you here. And Ibu Adelina is also the former Director of Sustainable have Dr. Erin Huey. She's the Director of Global Operations at the Pacific Disaster Center. And she's also the former Managing Editor of Risk, Hazard, and Crisis and Public Policy at the Policy Studies Organization. So, ladies and gentlemen, together with our great speakers, we're going to be discussing an array of topics. We're going to be connecting and introducing to all of you the need for broader approaches in tackling climate change, the importance of planetary health approaches in mitigating the negative impacts of disasters. And we're also going to be mentioning the disasters that we faced since 2 years ago, and that is the pandemic, and also on how to best help our governments and each other for the current and future risks too. So we're going to especially highlight, as you can see here, the transformation pushed for women by women too. As we know, helping just a society in general and not really focusing on the needs of women, it's basically telling half of the story and half of the solution. And that is the reason why we need to push for transformation for women. And disaster risk reduction is indeed a critical component of disaster management and has gained prominence in the international discourse and action. And that is the reason why we're going to be talking about this now. And once again, ladies and gentlemen, please allow us to have you be engaged with all of us. For those of you who would like to ask questions, do not hesitate to just raise your hand and tell us your name and your institution, and then ask our speakers. So before we start, I would like to have our speakers to introduce themselves, tell us regarding your latest task and how you've been. And we're going to start with Dr. Jamila.
Right. Thank you very much, Amelia. Thank you very much to those who have made it today physically, and to our viewers online on Zoom. Please, thank you for being here. As you mentioned, Amelia, I was reflecting, and from the first time the Yokohama discussions in 1995 right up to Sendai in 2015, I have been involved in this, which shows how old I am. But it also shows that I'm still believing in change, and I'm still believing in the possibilities of us building a better system together, or a better set of systems together. Now, today, you know, as we sit here with the topic about transformation, and let's just reflect on the last 2 years where we've all gone through a horrific pandemic. Our lives have been disrupted. Loved ones have passed away or have been ill. And I think it's 6 degrees of separation till we know someone who's been very badly affected by COVID. And I'm so glad everyone here is healthy and well and able to finally meet each other after 2 years. So we've also had that 2 years to reflect upon the fact that a health crisis does not stop other disasters happening. In my country, Malaysia, we had floods. In Philippines, they had a cyclone. In Indonesia, it's not short as well. As you know, we all often joke that, you know, Indonesia is the supermarket of disasters and Philippines is the 7-Eleven. Unfortunately, Malaysia is also having our fair share of little floods, some of them fairly major. So we've all been on this journey from from Yokohama, Hyogo to Sendai in different iterations of disaster risk reduction, while at the same time, the humanitarian sector, that is the response and resilience sector, I suppose, is looking at an agenda for humanity. And then we have the Sustainable Development Goals. So you'll see that all these different sets of parallel processes going on when actually everything collides, and you can't really, you know, sometimes differentiate that humanitarian development, and therefore the whole nexus, dialogue appears, right? Yeah. So I'm here to convince you that we need a rethink, and that we need to have a different approach to how we manage issues, because it doesn't work to work in silos. It's fantastic we've had all these strategies, but these strategies have been built with people who are like-minded, like us. So we've never really been able to challenge ourselves a little bit more. So I'm here to challenge. So I'm bringing the whole topic of planetary health. Now, I am a physician by training, a doctor. I am an obstetrician and gynecologist, and I keep telling everyone the only reason why I've been able to push things along is because the 3 words I've been trained to use most in my career are push, push, and push. So I'm here to push again, all of you. If you have to leave this panel with at least being curious enough to Google planetary health, and to be curious on why I'm passionate about it. So in 2014, 2015, the Rockefeller Lancet Commission looked at the status of health in the world and realized that you cannot separate the health of humanity with the health of the planet. And therefore, an integrated approach is required to improve our relationship with planet Earth. We want to achieve the highest standard of attainable of health and well-being and equity, and all within safe environmental limits. And this is the difference. This is why it's different from SDGs or the Agenda for Humanity or DRR. In planetary health, 9 indicators for planetary boundaries have been described by Johan Rockström and Swedish Stockholm Resilience Center. What it means is that there are 9 indicators for us to live within the safe space for humanity. And these include, obviously, the CO2 levels, acidification of the oceans, phosphorus in the soil, nitrates, nitrogens, microplastics, all these other elements. And if we don't watch these boundaries and exceed them, we are risking humanity, all of humanity. And it will, one crisis in one place affects another. And we've seen this with COVID. We've seen how a virus has jumped from an animal to another animal to a human being. And why? It wasn't out of the blue. It was because of our development that has not taken into account the planetary boundaries, that has destroyed the environment and created those risks. Now, those risks are the same as the risks you create when you have a landslide or flood, or you have terrible natural hazards that occur and impact people's lives, because you have built cities, we have overpopulated world, we have haphazard development and urbanization, and all this increases our risks in all aspects, whether it's health or disasters and so forth. So planetary health is pushing an approach that is slightly different, that is about taking a longer term view, because short-termism is not going to help us address some of the complex challenges we face. When I started as a humanitarian, we were dealing with a crisis. You have a natural, I hate the word natural disaster because there's no such thing as a natural disaster, but disasters from natural hazards, usually they happen, they end. But what happens now is, because of the impact of the climate crisis, you have a flood, and you have another flood, and you have another flood, and you have another flood. And before you can recover from the floods, you have a drought. So, it's complexity, layers of complexity. At the same time, in the past, in the humanitarian sector, you have a conflict, and usually it's fairly short-lived. And yet now we have conflicts that are going past decades. So that short-termism in our approaches, our strategy development, does not work anymore. We need to have a long-term view. So if I give the example of why we approach it this way, is that planetary health demands from us much more focus on political, economic, and social systems that must change and transform to protect us and to protect Earth and all the natural systems, so that both humanity and the planet can thrive. Now, it may sound a bit like, is it too idealistic? Politicians don't have long-term thinking. They think in terms of the time they're on, they're around, right? But how do we engage and get them to think about the long-term thinking? And I think many politicians, I hope, will realize they have no choice. One, the world is very different from what it was before. We have young people who are engaged. We have seen how they have demanded from leaders, a change in how resources are used and what kind of, planet they want to live on. Just today, I opened the news and Exxon's leadership had to be changed because of climate activists from young people. So this is happening. If they're deaf and blind to the changes in the demography of the world today and within national boundaries as well, then they're going to be in for big surprises. And I say that long-term thinking is required because what planetary health is telling us is that it's not the right thing to just blame one party. It's very easy to say, the government didn't do this, therefore we have floods. But planetary health is based on the position that we live in the age of the Anthropocene, where humanity is driving change for the better or for the worse. And therefore, as humanitarians, disaster risk reduction communities and sustainable development communities talking about people at the center, they look at people at the center as victims, vulnerable. Actually, they are the ones who destroyed the world. They are the causes of the crisis, you and I. our insatiable need for stuff. We order stuff and it comes wrapped in tons of plastic and we don't complain. You know, thank God this place has bottled water, right? But how many conferences have you been to that has plastic everywhere? And until and unless you and I and others are convinced that planetary health, which tells us it is us that is driving change, both good and bad, and that change must come from us, the transformation comes when we, as citizens of this earth, realize that we have a role to play. So let me give you some very clear examples. My country had terrible flooding recently, right? And the people were suffering. We weren't used to this, right? We always thought we were protected by Indonesia and Philippines, right? We always like, oh, Indonesia and Philippines will get it first. We will be shielded, but no more because of the climate crisis. So everyone was angry. Nothing was right. But if you look into the drainage, there was so much stuff in there, plastic bottles, you know, we even had mattresses and the gas tanks and so forth thrown in by people. How on earth do you not expect your drainage to not be blocked, that you will actually have flooding? So until we realize that part of the problem is that we haven't been able to convince the human race that they are implicit in the damage that is being done onto the planet, therefore giving rise to the disasters that we call natural disasters, then, you know, we will always be coming every 4 years to a global platform and every 10, 15 years to a major conference to discuss development goals or whatever, and we will not get very far. In 2030, the Sendai framework ends. In 2030 is also the end of the Sustainable Development Goals. The SDGs were really probably the best kind of strategic output from member states, because it really it's ambitious, it has 17 goals, but it failed to look at what drove the crisis. Why is it that we are poor? Why is it that people don't have health? Why is there gender inequality? It is because of human beings. It's because of our decisions, our policies, our actions. So I hope that I have at least given you a glimpse into planetary health, because today we live in a world of colliding crises. We no longer have linear situations. We no longer have the privilege of planning for one thing at a time. We need to be able to put on that lens, that planetary health lens, to look at where is it, where did this come from, and therefore what might we do starting from the beginning on how we address it. So let me tell you a little bit about what I do then. So I have now moved into a university and set up a Sunway Center for Planetary Health. Sunway is a private university in Malaysia, which has embraced planetary health and SDGs to the limit. You cannot find anything plastic on the university. But what we're doing is to make sure that every student who graduates from the university will complete a mandatory course in planetary health, which is applicable to their discipline. So it's about, if you're an engineer, what does planetary health look like? Because we believe that long-term thinking is that when you go out there to be our leaders, you will be able to make the right decisions because you realize the link between human health, human well-being, equity, and the planet are all interconnected. And because it's all interconnected, what we do to the world comes back to us, and not always in the ways that we would like to expect. So with that, my call is that, first of all, put on the planetary health lens. Anything beyond Sendai and SDGs must have a planetary health framework around it. Start with people at the center, not just as the vulnerable, but as the solution and as the change that must happen at individual and anthropogenic levels for us to see change, not perhaps in our lifetime. And finally, we all have to be good ancestors. We have to think about what our great-great-great-grandchildren are going to say about our generation, that have left them a world that has been damaged in so many ways, that has created so many risks. And I think it's not too late to start putting in place some of these measures and really applying the planetary health principles to everything that we do. So thank you, Leah.
Thank you very much, Dr. Jamila, for the yes, thank you so much for the presentation, as well as on emphasizing the importance of a planetary health approach. And now, speaking of this solution-oriented field, it is undoubtedly a movement that we need to start not just right now here in this conference room, but also in schools, as Dr. Jamila has stated. And now, as the future of global health is also connected to planetary health, I'd like to ask Ibu Kara, you are the head of the Anticipation Hub and based in Berlin right now. Could you please tell us regarding your latest task, as well as speaking of global health being connected to Planetary Hub? We've seen that the global pandemic has exposed the vulnerabilities as well as the inequalities, especially to those who are the most vulnerable in the world. And my question is, what could we have done or anticipated, and what could we have done to prevent the next pandemic?
Thank you, Amelia. And again, I just want to also say how happy I am today to be joining this panel of fellow of leaders in Southeast Asia. So I'm actually Indonesian. I'm happy to be back home while based in Berlin. So just a little bit about the Anticipation Hub. We are promoting the concept of anticipatory action. What is anticipatory action? So for the longest time, the humanitarian response, the approach for humanitarian response have been very proactive rather than reactive rather than proactive. We have been working in this mode for a long time. Of course, we have also advanced and strengthened our approaches. But just let me give you one data that we learned from last year from the START network. About 55% of disaster and crisis in the world are somewhat predictable, but only 1% of those disasters actually are have financing arrangements. So the anticipatory action movement or approach is really looking into how we can make faster decisions to reduce the impact of predictable disasters. Again, I think this is, of course, we are talking about different time scale, but it's just about futures and having that foresight, thinking through how we can anticipate crisis. So the idea around anticipatory action is using science. So for anticipatory action, we are applying it. Now we are looking also into applying it for health, but primarily it is being applied for hydrometeorological hazards, typhoon, floods, heat wave. So we are using science, risk analysis, and we are marrying this with pre-agreed plan and also pre-arranged financing. So these three components make up anticipatory action that could also, as I mentioned, reduce the impact of predictable disasters. And the Anticipation Hub is convening now. We are an initiative that is hosted by the German Red Cross in collaboration with the International Federation of Red Crescent Societies and the Red Cross Development Center. We bring together 93 partners now. And I have to say it's quite quick because we actually just launched last year, 2020 in December. And one of our partners actually was also where Adelina was, the AHA Center, and many others. It's from the UN, the Red Cross movement, academia, think tanks, some governments as well, and also other network initiatives. So we are really trying to bring that knowledge, the expertise on anticipatory action all around the world. Right now, our membership are representing, I believe, 39 countries. So this is where we are going, really building, whether you are working on your humanitarian assistance or building resilience, that thinking through the future across the different time scale is really important, and making sure you have a decision-making mechanism within your approach that enables decision to get taken faster, no matter what hazard it is. And for the question on who is the most vulnerable, I think for the climate change, of course, specifically on climate change, we are looking at everyone is impacted, but everyone is impacted differently. And again, we are here in a panel with women, and I would just point out also, Amelia, across the different vulnerable groups affected, the worst affected are women indeed, because women are disproportionately affected because of there's an inequitable, let's say, balance of roles, power, and also resources. There are also an issue of cultural norms. So you can imagine, for example, around the childbearing, if women are bearing and also taking care of children, they're mostly left at home when men are going, for example, migrating elsewhere. And of course, if you have in a society where women don't have that power to decide, to take votes, to influence decisions about how we are protected, how governments or local governments are, let's say, investing on what to do or how to act basically in disasters. It's also an issue. So these are around some of the issues, some of the way that women are more impacted climate change. But I also just want to again raise that point from Jamila right now for in order to anticipate and also work on futures, we need to understand better this compound risk. So this holistic approach is very important because it's now, you know, COVID, climate, conflict, they are colliding. So the understanding of what lies beneath and how to address that from the beginning, that's very important.
Thank you so much, Ibu Kara, and ladies and gentlemen, and Ibu Adelina. Us here being in a beautiful Bali, we need to also state the fact that Indonesia has unfortunately was named as one of the first and the worst responders of COVID outbreaks in Asia and the world. And Indonesia is also very prone to natural disasters. And Ibu Kara has just now mentioned that this is from the Anticipation Hub, that around 55% of disasters are actually able to be predicted, whereas only 1% of the prediction have been delivered or at least responded. And now, Ibu Adelina, what I want to ask is, what could we have done better in Indonesia, considering that it is a country that is the largest economy in Southeast Asia, with so many disaster incidents happening? Why are we not anticipating or maybe working better with hubs like the Anticipation Hub, for example, and also regarding on the gender issues, for example? What is the relationship between genders as well as the between genders and the disaster reduction responses?
Is it on? Oh, yeah. Just talking. Okay. Well, this is like the first time I do this in person after 2 years. So it's a pleasure to be here. And thank you so much for coming and for listening to us, those through Zoom and also here. The last time we met, actually, we were in Bali. Kara and I attended the 35 wedding anniversary of Ibu Jamila Mahmud and also the 60th birthday. So I revealed your age, but it was December 2019, just before the COVID. And now we are here again, right? After doing the karaoke. Kara is also okay singer, and now we are sharing the panel together. So thank you very much for your question. So there's this joke, and Ibu Jamila has mentioned it, that Indonesia is the 7-Eleven. No, Indonesia is the supermarket of disaster. Philippines is the 7-Eleven of disaster. So there's another joke, right? In ASEAN, in Indonesia and in the Philippines, if you have one, and you get one for free. And then there is also another joke. It's basically a laboratory of disasters because you have almost everything except the snow avalanche. You name it, you get it. 1 + 1, basically. But it should not be a joke, because we should become the teacher of our own experience. And it's about time that Indonesia become the host of this global platform, because we have been the host of world-class disasters. Not only small disasters, world-class disasters like the 2004 Indian Ocean tsunami. And ASEAN too, sharing it with the Philippines and Myanmar and some other countries, we have been also the host of the world-class disasters. So what is actually the best source of experience is from our own experience. Now, there is this, so-called the bell curve, right? You've got the peak in the middle. There must be a reason why it is called Yokohama Hyogo Framework for Action or Sendai Framework for Action. Because we have been looking at Japan as the Mecca when it comes to disaster risk reduction. And it is good. There's so much to learn from Japan. But we also need other models. And what I want Indonesia as the host of GPDRR is to come up with these other models other than Japan and other parts of the world. Can Indonesia do it along with those in the global south? The bell curve, right? Indonesia represents most of the countries that have this so-called natural disasters, right? And we have our own experience to share. Now, I forced Ibu Jamila, was it 2 nights ago, to eat dirty duck. Dirty duck is the typical dish in Bali. So you should try it if you're foreigners, yeah? But building resilience, you cannot mass produce resilience. It's as if you basically force the dirty duck, the Balinese dirty duck, to wear Zara clothes. It doesn't fit. It's a complete misfit. Building resilience is local. It's customized. It's got to be customized like my batik clothes. You cannot put on, same size for every disaster or for every country. So that, I think, is something that Indonesia and other countries should do, that we bring the social and cultural fabrics, the local knowledge and wisdom, blended with the knowledge, right, from other countries like Japan, but we own it. And we develop and contextualize disaster so that the dirty duck will have its own, batik to wear, not the Zara clothes. So that's what I think about why Indonesia should be the host. It's about time. Now, about the international frameworks and the regional frameworks. I was with the ASEAN system for almost 3 decades. So you can tell me how old I am. Still younger than Ibu Jamila, but older than Karna. But I'm happy to have this experience growing up in the ASEAN system, because I have the privilege working for the 10 countries and also learning from the international, development, the policy, and so on and so forth. But being outside of the system right now, it gives you different perspective, and it basically challenged me as an academic, because I'm now with the ISIS Yusof Ishak Institute in Singapore as the senior fellow. It gives me different perspective, and I completed my duties as the executive director last August. So that was like also another life-changing experience. And joining the academic circle, right? I was being asked question, why? So I also asked the question, Ibu Jamila, what is the difference between DRR, disaster risk reduction, and planetary health? And then we have this question, why should be women pushing for the future of SDGs, DRR, and also considering planetary health? So this is my reflection. I discovered at least 6, Amelia. One, okay, and this is my reflection being in the ASEAN system and also watching how international and regional instruments were developed. there is this so-called consensus. Yeah, but the consensus is the lowest common denominator in terms of decision making. Basically, well, it's a good way to get everybody on board, right? But then we often have to compromise and we lower the bar so that everybody could agree and adopt that declaration or the framework for action or the agreement and so on and so forth. And then we only discuss what we agree to discuss, right? And then we only agree until everybody agrees. So you imagine that has been, the mode of decision making when it's not only at the regional but also at the international level, because I was one of those delegates waiting for an international framework to be concluded. So because it has, rely on the lowest common denominator, the question is, have we come up with the international or regional framework to really address the problem, or we actually let ourselves to just be feeling happy that we have concluded something? It's like, being a mice on the what do you call that? On the wheel. Yeah, we get exhausted, we get tired, but we are not getting anywhere. Yeah. Right. So I think it goes back to the issue. Have we really recognized the problems and the underlying problems, and have we actually chosen the right decision and actions to make? Right? Because if everything is by the lowest common denominator, then how can we solve the biggest problem that we have? And I would have to say 2030 is not far from now. It's there. We can see the horizon, but it has to be beyond the horizon. It has to be beyond 2030. But we tend to be short-sighted and only think about our lifetime. So that is wrong with the international frameworks and sometimes, the regional frameworks. And then after we complete 2030, and then you roll it up to the next plan of action or the next framework. So are we really addressing the problem? Or we actually become hallucinated, like the mice running on the wheel, and we're not getting anywhere. So I guess that's the question that we have to ask ourselves. I don't have the answer, but perhaps planetary health is the answer. Can we address these underlying problems? Are we comfortable? Because when it comes to underlying problems, these are often sensitive. And as politicians, as regional organization, as international organization, we often are not comfortable, and we only choose to decide on what we all can decide and agree until everybody agrees. Mm-hmm. Are we going to continue like that? Well, people cannot wait until 2030 to be not hungry anymore, or to get out of the poverty line. So what is wrong? Can planetary health help? I don't know. That's my question.
Thank you so much, Ibu Adelina, for the excellent response, as well as giving us the clarity of why we need clear targets moving forward, as well as the need to customize assistance. And Dr. Jamila, just now Ibu Kara has also emphasized on the need to deliver clear information, be it on anticipation, on predictions of disasters. And you have just now, what I love is that you have pushed for a community's accountability, to have them be responsible. You caused these damages or this natural disaster. We must learn not to do it again. So my question for you is, you also mentioned regarding long-term thinking, which politicians lack. From all that, I am gathering that we actually need earlier start in the education system when it comes to planetary health approach. What do you think about that?
Yeah, before I talk about education, I think what we need is what a lot of civil society organizations and communities have been doing, the really bottom-up approach, right? Really building it from the bottom, getting the communication to communities. We've seen this in COVID. You can have the best health facilities, but when people don't trust the information, or people don't trust the government, they will not comply, right? They will not wear a mask. They will not get vaccinated because, of all the conspiracy theories and so forth. So I think it's about building trust, and that has to be at the community level, village level, and all that. And that's, the basics of what we do in disaster risk reduction as well. So coming back to your question on how do we get politicians to, the long-term thinking, right? I think we need politicians buy-in. It doesn't mean that it's only politicians that will actually change things. I just mentioned about the role of young people. But I also mentioned that it's economic, social, and behavioral, right, changes and societal changes. So I think the economic drivers are going to be very important. Ultimately, sometimes, it's very easy for us to say this in Bali, but people who are poor may have no choice because the food that they can get, the cheapest, is probably wrapped in plastic and they have no choice. So it's about getting that social equity right as well, the economic drivers. So let me give you a couple of things that we have been testing and going to implement. Some of you may heard of donut economics or values-based economics from Mariana Mazzucato or Kate Rayworth. What it says is that our GDP model of economic growth is no longer the model we should be following, because it is a model of growth and capitalism. It doesn't take into account society. Now, in the donut economic model, the difference with the donut economic model is, if you can imagine a donut with a hole in it, the outer ring is the ecological ceiling, which is actually your planetary boundaries. The inner ring is your social floor, and there are indicators there too, like access to health, access to education, gender equality, justice, and so on and so forth. So for humanity to have that safe space to live, which is the meat of the donut, we should not try to transgress the outer ecological ceiling, which is the planetary boundaries. And we should also not have such a low access to the social floor so that people fall into the hole. And let's not be naive. You cannot just say, no, we're not going to do any development that's going to damage the planet. It's impossible at this stage. But, human beings are creative. If you talk about the economic activities today, the social entrepreneurship, you've seen now, circular economies and so forth, upcycling, recycling. But donut economics is about finding balance. So one of the things that's been done is that in Amsterdam, it was the first ever donut city. So to become a donut city, you have to engage communities to say, what is it the community needs? Transportation, energy, housing, healthcare, and so on and so forth. And therefore making sure that their access to these, basic rights and privileges are in a way that is sustainable. So if you go to Amsterdam, they created good walkways. People cycle in Amsterdam. There's no real need for cars. If there are going to be cars in Oslo, it will be electric cars. So all those incentives and decisions and policies made, that also drives the economy, but doesn't make it environmentally damaging, right? And then, creating those choices, how you develop cities. If I talk about food, as we sit here, we are going through a global food crisis. The price of food has risen so much that many people around the world are not able to feed themselves, even in what we call the global north, because food has become unaffordable. But in my country, 45% of the food that arrives at the landfills are still edible, but they turn to methane, which is one of the most damaging greenhouse gases. The amount of food that arrives at the landfill can feed 12 million people 3 times a day in my country. So can you imagine how it is in other countries as well? So until we change human behavior, this is why planetary health is so important, that it's all interlinked. Your behavior in the way you spoil food or throw food to the landfills, the methane that's produced, the climate crisis that ensues, the flooding, the cyclones and everything else, the droughts that happen because of your behavior in not being able to shop in a much more smart way. Our consumption of meat, for example, is driving the climate crisis. At the same time, our consumption of meat has given no choice to farmers but to give their livestock antibiotics. And therefore, by 2050, 10 million people a year will die for an antimicrobial resistance. It's all linked. So the health of humanity is so dependent on the health of the planet, and the health of the planet is affected by us. And as a consequence, a lot of the disasters that people like Kara are trying very hard to anticipate and put in place financial sort of band-aids, right? To be able to get people out of that danger. It's not sustainable. We need a rethink of the problems and the solutions that we need to develop.
And Dr. Jamila, also on the emphasizing on the role of women in a transformation and a better future, we also must point out that in many cases, in most communities, men's and women's roles are different, their responsibilities are different, yet in many countries, female leadership is still lacking. Yeah. Although women's recovery and efforts to help them is only basically 80% or 70% of the entire story, as women are mostly the heads of families. They are affecting families, communities, and the nation. And how they get access to resources are also different. The way they recover from ordeals are also different. So how is it related, this gender and disaster reduction, risk reduction issues, as well as planetary health approaches? What are the connections between those three?
Yeah. So I like to talk about feminist leadership. And feminist leadership doesn't only apply to women. It's the principles of feminist leadership: being empathetic, open, collaborative, being good listeners, being able to solve problems. And if you look at crisis in this world today, the COVID-19 response, the best results have come out from countries that have had women leaders. And I think that I would argue that not many conflicts in the world were started by women. There's probably politically incorrect joke that, if there were more women leaders, you wouldn't have wars. You just have countries not talking to each other for a while, right? But the fact is that, that feministic leadership is so important. I used to be the chair of Oxfam, and Oxfam is based on the principles of feministic leadership. So if you get feministic leadership into men and boys, and it has to begin with men and boys being partners to women. I as a feminist myself, right, I can shout as much as I like about, yes, I need 30% of people on the board who are women, or 40% or whatever. Yes, we demand that. But at the same time, it's even more powerful when men demand it too, right? And I think, we have to call out the hypocrisy sometimes, right? I'm sorry if this offends anyone. So I have a lot of friends from South Asia, and they tell me about, gender equality and all that. And I ask them, do you have a son? And they say, yes. I said, when your son gets married, do you demand a dowry? And they said, yes, because it's our culture. I said, well, if you as a woman cannot change that culture to ensure that your daughter does not have to pay a hefty dowry to get married to a man, then what, where are we going to succeed, right? We women have to change too. So it's about, really change comes from all sides, but it is hard, right? But I don't think, if I look back now on what it was before and now, I think women now are more educated. More women go to university than men in many parts of the world. And therefore, how do we then create that talent pipeline of women to become leaders? And this requires sponsors. It requires sponsors, and most of the time the sponsors are men. And I have been very privileged that everyone who has mentored me has been a man, and who are feminists, who are true believers in equality and equal rights. So I think these are the conversations we need to have, right? These are the demands we need to make of others. In this conference itself, I've popped into a couple and I look at all the men on the panels. And how many of us are outraged about this? How many of us have gone to the secretariat to say, why are the panels all male, or at least one token female with Kara there? Right? When will we get that feminist leadership? I had a boss. I was the Undersecretary General of the Federation. My Secretary General was a real feminist. It helps because he's 6'8" and really tall. And every time there was only one woman on the panel, he'd step off. Every time there's an invitation, he would ask how many women are on the panel. He wouldn't attend if there was only men. And when he comes to the panel and he realizes there's only one token woman, most of the time he steps off and he grabs my hand and pushes me on the stage. How many men are willing to do that? So it begins with education. It begins with us teaching our boys and our girls at home about gender equality. Don't blame other people. If you as a parent, as a sibling, have not done it yourself, again, I'm going back to us as individuals, then I think, we have to start from there.
Thank you so much, Ibu Jamila. Let's give her a big round of applause. I would like to strongly push that message forward, really. And now, Ibu Adelina, just now how Dr. Jamila has stated regarding the importance of females' roles in pushing for transformation, what cases have you witnessed, for example, that you have really seen and understand and realized the importance of giving females the roles or the positions of leadership, such as yourself, for example? What are the ups that you have seen? But otherwise, also, there's so many women out there, they're educated, but they have not really, the opportunities given to them are not as fairly compared to men. What do you think of that issue?
Thank you, Amelia. What a great question. There were times in my life when actually I didn't realize that I have broken the so-called glass ceiling until somebody told me. So when I became the executive director of AHA Center, Ibu Jamila said, "Oh, congratulations, Adelina, you have broken the glass ceiling." I didn't realize it. And only after some decades later, somebody told me, "Oh, Adelina, you're the first team leader leading the ASEAN assessment team in 2008. Well, I didn't realize it only later until somebody talked about it. So there were like many instances. It's not that I'm not proud of it, and it's not that I don't appreciate that, but sometimes I forget about it because perhaps I have decided to change my mindset, and I decided not to I have decided to tell myself that I'm not different from men. But it's not only, it just didn't happen that way, because I have a feminist father. I think he's a feminist because it's only two of us, me and my twin sister. And my twin sister is an architect. Yes, there's someone who looks like me, but she's an architect. But never, ever, my father mentioned to us that he would prefer to have sons over daughters. Never. So I never, had the experience. But I have this privilege. But not everybody, not every, girl had that kind of privilege. So those who have the privilege, I think we need to actually share more, right? We need to fight more for others, and we need to showcase and share our stories more, because we have been given that privilege. Yes. Somebody has fought for us. In my case, it's my father, continued with my husband, who I think is a feminist, right? You have met my husband. So we have that responsibility, because not everybody has that privilege. But I think those who have the privilege have to change their mindset first. Otherwise, you won't get there. So that's, the story that I told myself. And sometimes, you'll find people who underestimate women. So one of the people in this room told me, somebody in my assessment team told her that, she got underestimated because she told her male assessment member that, she was worried that pregnant women have to go through stairs in the evacuation center, right, to register and so forth, and that she got ignored, right? You remember that, Jen, right? And the male just ignored that kind of assessment. And I was in one evacuation center, and I noticed that the curtain is very easy to be open, right? You just get there, and then women spreading their legs, people can just come in. But men don't see that because they're not women. They think differently, right? And they don't appreciate that. But sometimes women get ignored. But there is this UCLA study that actually has done research on the human brain, and it tells us that women have more empathy to the sufferings. So it is important to have women in your assessment team, to actually be in your disaster response team, because they have this empathy towards the suffering. And when we talk about suffering, that's, disaster, a lot of people suffer. So I think if you have the privilege to be in that position, then you have to fight for that. And you have to listen more and allow for those voices to be heard and not just to dismiss it. And, as the, perhaps as the executive director, I was not, doing that enough, but I keep reminding myself that I should be doing more. And I think we all have that responsibility to do so.
Thank you so much, Ibu Adelina. And I already see several hands raised. So yes, if we could have the mic, or you could just propose. Oh yes, I see an organizer handing the mic to the gentleman. Thank you very much.
And then the lady at the back. And there. Oh, lots of questions.
Thank you so much.
Hi, so my name is Jali Long, so I'll just call myself Hari. I'm finishing up my medical school, and I'm a fellow for the Global Consortium of Climate Change and Health Education. Okay, I'm a fellow for the Global Consortium of Climate Change and Health Education, and I'm part of the youth constituency in the SEM, as I'm, in a new youth-led global health think tank. So when I was attending for the past 3 days, an observation that I've made, which I've shared with a couple of other officials in the UNDRR, and they kind of agree, is the health is not really talked about in the disaster risk reduction space. And they talk about health systems and health infrastructure, but not the other aspects of health. So I've also heard about policy coherence and integration in climate change and disaster risk reduction. So for my first question, it would be, what exactly needs to be there to integrate the planetary health discourse in the disaster risk reduction space and get the conversation going? I understand we are probably the top 20% of the world's population, but we need to start first for it to continue forward.
Yeah.
And the second question is, it's more of a personal question, but also I think I represent the other youth when asking, what role do you see for the young people to engage in planetary health beyond planetary health education and advocacy discourse? How do we go forward from here? Thank you so much.
Excellent question. And I'm guessing those two questions are directed to you, Dr. Jamila.
Maybe we take all the questions.
We take all the questions? Okay, wonderful. And we'd like to ask the gentleman
The
with
lady
the,
in the back first.
and the lady in the back first afterwards. Okay, sir, you may go on. And then afterwards, the lady in the back. You're welcome.
Thank you very much.
Yeah.
My name is Safianto Amri. I'm from the Indonesian Society for Disaster Management.
I'm so sorry. Could you please speak closer to the mic?
Yes,
Thank you.
sure. So I'm very intrigued with what Professor Jamila said about behavior change, right? Because we've seen, and I've raised this question before, in these pandemic situations, we've seen how the world changed their behavior to become more conscious on health protocols. You have to wear your mask, you hand washing, and also you do safe distance. And that's takes us in just 2 years' time, where people are conscious to do that. But then when we see that in our case, in our government saying that you can relax the protocols, then people then start to shift their behavior back again to the normal way, to the before. Now, my question is, if we use this context for disaster resilience, where we want to build sustainable resilience, how can we make sure that the change of the behaviors that we want to enforce sticks with the people? How can change be sustainable? How that behavior can become sustainable? And because we have so many inspiring female panelists here, where does women fits there? Do you think women is more prone to become back their behaviors and towards less resilience? Or do you see that women is actually can be drivers for making sure that behavior change becomes sustainable?
Wonder.
I couldn't understand. You can wrap up. Yes.
Thank you so much for the
Thank you.
great question. And I may, if you would allow me to collect one more question from the lady wearing the green dress. Thank you very much.
Good evening to everyone. I'm Selina Wasiafa from Liberia. I work with the Ministry of Gender, Children, and Social Protection. So my attention is drawn to the theme. It's a women pushing for transformation. So what recommendation can our panelists give to the international community concerning women empowerment, taking into consideration Africa, where women are faced with a lot of discrimination, domestic violence, and non-empowerment program being put into place? What recommendation can you give to our international community that we can start to look at continents or countries that are faced with these challenges? Thank you.
Thank you very much. And okay, I'm going to have the Dr. Jamila answer regarding behavioral studies and planetary health approaches. Thank you.
So I think the first question, I'm very happy that as a medical student you're here because it's very important that you start leading the health sector. So you asked about health and disaster risk reduction and how do you integrate and why is it always missing? You're absolutely spot on. Whether you look at disaster risk reduction or you look at finance, right? Sustainable financing. Very rarely do you get a lot of dialogue around health, right? So it's health is always seen as a separate thing. But COVID has woken us up, I hope, that is not separate. It's all essential to how everything works. So a few ideas. One is, yes, infrastructure is one. The second, of course, is medical training. If we don't start building into health training that doctors and healthcare workers must not just be doctors for people, but also doctors for the planet, then that's a really good place to start. So I can give you some examples. There is an organization called Healthcare Without Harm, which is doing amazing work. It's based, it's global, but the Asian sort of setup is in Philippines. So what they're doing is helping healthcare systems look at themselves again to become much more green, much more sustainable, much more embracing planetary health. So at COP26, there was a race to zero for the healthcare sector per se. Now, you will realize in the past, the previous COPs, the Conference of Parties, never really had a health focus. But because of COVID, COP26 in Glasgow was quite, started to have health presence and discussions. So Healthcare Without Harm with the Race to Zero has already, asked people to sign up to becoming a zero carbon by 2050. So my university belongs to a very, very big conglomerate that also owns healthcare facilities. So we are the only healthcare facility in the country that signed up to Race to Zero. So what's happening now is that it's being quite smart, because the Sunway Group also has organic farming and hydroponics and all sorts of stuff. So looking at, for example, what kind of plant-based diet can be put into hospital food systems, what kind of energy consumption will the hospital run on. As a developer, that is developing new hospitals around the country, how does it build on the donut economic model to look at making sure that the economic model, the finance model, the social model, is right for healthcare. So there are a lot of very interesting and innovative things happening in the health sector. So our hope as well is that we want to set up a Masters in Public and Global Health soon, and that will actually include planetary health as a discipline. It is taking traction. The London School of Hygiene and Tropical Medicine now has a Center for Climate and Planetary Health. There are lots more. We need to create more awareness, but also to the health professionals. As you specialize in health, many people will go to surgery and medicine and so forth, right? But I think what we want to do is also make sure that there will be healthcare sort of experts who will want to embrace, especially those who have lived through COVID, to look at the public global health aspects and planetary health. Now, in terms of behavioral change, in terms of youth, so what we're trying to do with the universities, we have done things like youth boot camps. We're going to run a boot camp for planetary health leadership. So really asking young people to come together in teams, innovate, come up with ideas, and we will reward them, and then take them through leadership development. Because I think it's really important to do that. I know in the audience today I have Sufyan from UNICEF Malaysia. So we're working, hoping to work with them now to really build on some of the youth programs and bringing that awareness. In terms of the curriculum we're developing, we hope that when it's ready in 2024, it will be open source, so that any university, any institution can take it, tweak it to their own needs, so that young people can start engaging. But most important, I think, for young people, it has to be meaningful. So this is where TikToks and Instagrams become very important. I just started a little channel called Planet Saving Meals, because I like to eat and I like to cook. So but I'm cooking now what we call Planet Saving Meals, things that I pick for my garden, right? With a real master chef, not me doing the demonstration. But that piques the interest of young people, right? To say, oh, well, this is quite fun. And we make it really funny and fun, and we laugh a lot, right? So how do you engage your audience? So the communication piece is going to be so important. I think not just for planetary health, but also disaster risk reduction and other things, right? Don't make it deathly boring that it is the doom and gloom scenario. The sense of possibility and hope. I think this is what we need a lot more of. Now, in behavioral change, this is there's so much that we have learned from the pandemic about behaviors, and there's a whole field of neuroscience about it. It will take me another hour to explain this, but I think that what is needed much more is for a multidisciplinary approach. And this is what planetary health is, right? It's about excessive collaboration, bringing the best minds and disciplines to think through together the solving of the problems. And in behavioral change, the answers may not come from the disaster management experts. It will come from the neuroscientists or the psychologists or whatever. And we have to learn from other disciplines. How do we learn from the private sector and how they've managed to convince people that, okay, I'm a big iPhone fan, right? But iPhones, the research that has been done on iPhone, in many, whenever we look at things, it triggers different parts of our brain. And, some will trigger your hunger area or whatever. Do you know which area the iPhone triggers in human beings that like the iPhone, or rather, use an iPhone? It's the area that is triggered for love. Now, how on earth did they do that, right, to us? But that's what's happening to the behavior. I know my friend doesn't like the iPhone here in this room, but I can't help it. I'm in love with my phone. So, it's a neuroscience. So how do we better understand neuroscience so that when we actually are talking about disaster risk reduction or, planetary health or, early response or early warning, we actually understand how the brain works. And I think we don't take enough time to understand that. So I think that requires a certain expertise.
Thank you very much. And now regarding the women in power and how best to collaborate with one another, maybe any of our speakers? Yes.
Yeah, I would like to, and actually I would also invite you to join. So I think it's really important to create that space, right? So we need to create that space and empower early. We have been hearing today in the discussion about youth, about education. We need to start there. So we are super excited that yesterday we launched the Future Leaders Network for Early Warning, Early Action. So this network is actually inviting all young career professionals, and our community is very much a mix of science, policymakers, and practitioners. And the main, I would say, sector constituents are people coming from the disaster management sector and also National Hydromet Services. So what we are really trying to do is having more women also join. Our co-chairs actually are coming from, one is from Kenya and one from in the Indonesian Met Office, DMKG. And it's really exciting. And I think what Jamila also mentioned about this TikTok generation, we actually created a format of speed dating online called Mingle, the Tinder for finding your early action partner. It is, and these are the way young people connect, and women as well. For us, this is what we are offering. And again, as a professional as well, we need to really be able also from our respective roles to help make that connection, to inspire and empower. I think that's my take on it.
Thank you so much, Ibu Kara. And one of the, I guess, the keys to delivering information is that it has to be engaging. And therefore, these social medias, be it sometimes you feel like, oh, maybe it's not necessary. They are actually necessary because those are the tools that you have that immediately can have you connect with your audience. And now, speaking of leaders, of leadership, many eyes are currently on the World Economic Forum right now, and all the leaders there, world leaders there, many of the keywords that they have been using, Ibu Kara, is sustainability. Lots of sustainability words everywhere. But do you think this contribution towards sustainability have been enough?
No, not enough.
No. Why is that?
I think, again, we are really fragmented in the way we think. So I'm of course working on anticipatory action, which is one solution for people and organizations to anticipate shocks. But it won't be sustainable unless we also work across sectors, across solutions. So this is also why we are here, right? We are at the Global Platform on Disaster Reduction to make sure that this is not seen as something that is separate from building disaster, from disaster risk reduction, from resilience, because we need the system to be able to support anticipatory approaches and anticipatory action in general. So this means that, you cannot just think about, this is what is the trend, for example, the humanitarian sector. A lot of the donors wanted to put the the fuel money. What I say, the fuel money is basically putting the global pot, global humanitarian financing pool, more money so that organizations can implement anticipatory action. But that's only the end. So if you put money in the pot, but you don't have, for example, the systems to absorb it, there's no capacity, it will not be able to be sustainable. And again, this is coming very much from the anticipatory action approaches, but unfortunately, a lot of the other approaches that we are supporting, innovating are very much built, developed in silos, right? So this is also our ask to the global platform on disaster reduction participants, speakers, to really help us try to make anticipatory action be that one of the approach that could be sustainable, that could be really helping us protect people at risk in a systematic way, and can be used also in all contexts. And yeah, that's
Can I follow up on that?
Yes, please.
Talking about sustainability. So I told you, Amelia, that I have a twin sister and she's an architect, and she never get it, what I do. She never understands basically what I do. She knows that, okay, I save lives and so forth. It feels great and it looks great and so on and so forth. But there's one thing that she finally gets it, and that is sustainability. Why? Because in her field of work, they're also doing the sustainability thing, right? Architect, upscaling and recycling materials and so on and so forth. So we finally found an intersection, and we decided to have our own podcast where my twin sister and I would host the podcast. And my twin sister will talk about sustainability using her perspective, of design and architecture. And I, from the perspective of disaster, risk reduction, humanitarian crisis, and so forth. But our target is actually the young audience, the students, right? The young people. And I think we need to do that more. That is to talk beyond our circles and to make sure that others get it. So my yardstick is my twin sister. If she doesn't get it, then others will not get it. So if 2030 coming soon. Not only that, ASEAN is actually right now formulating a post-25 agenda. So that is like 3 years from now. And Malaysia is the permanent lead shepherd country. Together with Cambodia as the chair of ASEAN, and next year Indonesia again is going to have a leadership role in defining what should be the vision of ASEAN post 2025, and that is 5 years ahead of the SDGs, 5 years ahead of the Sendai framework for disaster risk reduction. So what Indonesia is going to do in the area of sustainability, for example, or in the area of planetary health, right? It's something that I think we need to take into account. But if there is one thing, I think we need to really make sure that whatever international frameworks, whatever regional frameworks that we are having, it will touch on the ordinary people, the Balinese people included.
Thank you very much, Ibu Adelina. And yes, we would like to welcome you.
You should take the response to the lady in green
From Nigeria.
From Nigeria. Yeah.
Yeah,
You have already.
Yes, we welcome you, Bapak, to deliver your questions. Thank you very much. You could tell us your name and your institution as well as the questions that you would like to propose. Thank you.
It is not the question. I was told that session is interactive. That's why I just want to share my observations. It's not question, but question to all of us, including myself. There's some questions which I'm asking myself, and we're talking throughout the day of what's happening here. Like I attended one session yesterday. Oh, let me first congratulate to all of you. When I was reading the bio of the panelists or the speakers, all the former, but I realized that you are not former, you are still present. And then trying to change something from your past experiences, bringing to and attempting from your side. in that sense that to Dr. Jamila, Dr. Kemal, to other the speakers. Sorry, I forgot your name. I really congratulate you. I'm happy to join your session there. Going back to the session, we were participating the gender in DRR or women in DRR session yesterday, and we're talking of the silos, and there was also the talk of the silos, and we need to include that. And I was sharing with my colleague Jenny that sometimes I think, and I'm being skeptical these days, being in this field for last 20 years or more, we are in a way trying to create an agenda, disintegrating from the integration and then advocating for integration somehow. I want to repeat it. We are trying to specify the agenda and trying to define our domain that this is me. And then trying to put a boundary in. Just taking an example, we, Antua and myself, we've been colleagues for a long time. We're working for child-centered disaster risk reduction. There is organization I know, they're working for women resilience building. There might be another other organization working for youth resilience. Just thinking back, when we're thinking of the resilience, and then thinking of only one small segment of the society and focusing on that, without considering rest of 70% or the 60% of the environment, where that particular group would go and then react in their daily life, how we can build the resilience? Are we ourselves creating that silos or not? Just I'm asking myself, because I'm also part of this human field where I've been working for the last 20 years. And I'm also trying to create my own field. Integration, we're talking of UN Undersecretary General, talking of the integration. The parliamentarian participating in this session, global platform, talking of the integration. The high-level government official coming and joining, talking of the integration.
Yeah.
Then who is there not doing it?
Yeah.
Somewhere in a far, remote village where there is an individual farmer, he is the person to do integration, or who?
Yes, thank you. Okay, wonderful. Thank you so much for the input. And maybe if there's one more question that or response from the audience, we'd like to welcome. Thank you very much.
Thank you very much. My name is Marcus Busey. I'm the Chief Operating Officer and co-founder of Disaster Relief Australia. Firstly, I'd just like to thank you. This has been the best panel that I've been able to observe in the whole time I've been here. It's your candor and your willingness to point fingers and say you can do things differently and you can do things better. It's incredibly refreshing. So thank you very much. I have a question, but it's drawing off of points of each of your opening statements. In terms of planetary health, one of the things is we have to be able to not be so constrained by borders and be able to say, just because you're sitting behind one line and I'm on the other side of the line, and we can't work together. And it's very easy to make lofty statements around that. There has to be some real transformative change in that space. And to your opening comments around being able to be to anticipate and be agile, for me, for our organization, when we were talking about that, the first thing I thought about was culture. To build that culture of being able to lean in and not be afraid of taking risks. That risks are positive. And if you're able to close your OODA loop and not be afraid to step into things, then you can anticipate much quicker and much more adaptable. And back to your opening comment, our organization, when the Palu tsunami earthquake hit, we sent a small team from Australia because we thought that we had something very special that we could lend to help with the recovery effort there. And the government of Indonesia was being very standoffish about bringing in anybody from another country to come in and help with this. And we almost had to trick our way into being able to offer some assistance. And it actually wasn't the men that were making the decisions about these things. It was the wife of one and the daughter of another that said, hey, these guys actually can do something to help. And we were able to come in there and really provide some really powerful intelligence and analytic work that helped with the recovery effort. So I guess what I'm getting to is, what is your advice? We're here, my colleague Amy and I are here to introduce our organization, to say we want to build relationships across borders and to be able to go and help outside of Australia. But it's very, very difficult to do that. It's very difficult to start these relationships and actually navigate the bureaucracy to say, we're here, we're agile, we have something to offer, we can come and help you with these things, or be a part of your team. So what is your advice to help breaking down those borders, allowing people to think more in a more agile, adaptive way, and ultimately be able to come and work in Indonesia, work in Malaysia to be able to help? Thank you.
Thank you very much for the excellent questions. And maybe for the first question, oh yes, okay, we'd like to pull in more questions. Yes.
There's two questions.
Hello. Yeah, my name is Nadira. I have a question. I would like to direct this question to Dr. Jamila because it's a bit more, I would say, technical, programmatic kind of question. But when it comes to planetary health programming, one of the I would say gaps and also challenges as a program management and designing the program is that you look at the impact on a long term. But donor and government, they want to see short impact. And the donor always give you 1 year program, but we're talking about, I don't know, 10 to 20 years. And my question is that how do we address this? How can we advocate more to say, please give us some time. This is not something we can repair in such a short time. And yeah, and then also when we look at indicators, it's not on the donor side, it doesn't look sexy because it's the impact you can't really see that much. So most of the time, you can't really measure it at that particular after 1 year program. So yeah, that's all.
Thank you very much. So it is regarding the constraints of time and how planetary health approaches should not be constrained by borders, as well as the outstandish nature by governments. We're going to, I'm listing all the questions down and I'm going to have our speakers answer. And now we're going to have another lady, yes, to deliver your questions. Thank you very much.
Hi, yes. Hi, my name is Claudia. I'm here as an affiliate of the UCL Warning Research Center, which is also a partner of the Anticipation Hub. I do research on warning systems for infectious diseases, but I'm also a scientific advisor and researcher in the One Health team within the Department of Environment, Food and Rural Affairs in UK. And one of the main things I research and I advocate for is for an integration of the environmental drivers that lead to the emergence of infectious diseases, whether that is land use change and livestock production intensified, whether that's the use of antibiotics to compensate for poor animal husbandry conditions, deforestation, all these factors. And so my questions are you, Dr. Jamila, thinking about incorporating these concerns in your curriculum for your master? And also for the Anticipation Hub, you mentioned that now you're more involved in health strategies. I was wondering whether you're considering that, and also any suggestions about how to increase collaboration between these sectors, or how we can push forward for that consideration of the environmental drivers would be most appreciated. Thank you so much.
Yep.
Wonderful. Thank you very much. Yes, Ibu.
So which question? I will maybe address the question on the last question on anticipatory action and health, and also the question on engaging with the different initiatives and how to connect more directly. So on that end, for the Anticipation Hub, we actually just did an evaluation, and we were very happy to get one of the results saying that our partners, stakeholders and members, again, coming from all over the world, appreciate the approach of having this hierarchy-free participatory way of interacting. So now I'm coming to the working groups in the Anticipation Hub. We have different working groups on anticipatory action for health, in the conflict context, anticipatory action and risk financing. And again, I think also the pandemic taught us that working virtually can actually help us better connect. Of course, we are tired of the Zooms after 2.5 years, but it does have the effect that I was, for example, in one of our meetings, a volunteer from the Red Cross of Vanuatu actually was talking to our donor in Berlin. So this is what we are encouraging from our side, and the way that we design sessions, the way we design events are encouraging the inclusivity. So if you want to get in touch, and again with the working group, so just to say, these working groups are really very much partners led. So it's not us who is running the show. It's really on the health, for example, it's one German Red Cross co-chair and one climate center, Red Cross Climate Center co-chair. And these are basically, they have different expertise. So one is practitioner working more on emergencies. One is actually a scientist. So basically you can get together and you can have, let's say, colleagues from all over the world, and you define your own working packages. So whether you want to do a feasibility study for something, or you want to explore joint solutions for anticipatory action and health. So we are looking at dengue, we are looking at cholera at the moment. But if there is more expertise and interest in that area, we definitely would welcome suggestions, and please feel free to connect on that.
Thank you very much. And now, what about regarding the reluctance for institutions or governments from welcoming maybe environmentalists or foreign investors, for example, that want to help a nation? Maybe Ibu Adelina, you can maybe give advice to these maybe incoming foreign environmentalists that want to participate in the issues in Indonesia.
So someone told me that nowadays when investors actually decide, their strategy, they actually are asked whether they're investing in countries or in organizations or in companies that are caring for the environment. So there are these three elements: environment, social, and governance. So if the companies, right, are not taking into account the environmental values, your shareholders actually will question you. There are some examples out there, and then your stock value will go down. And then the other one is social. How actually good are you in terms of contributing to the society around you? And then the other one is governance. It's about, corruption and all that. So your shareholders, actually, we're talking about companies here. Your shareholders will now ask those questions nowadays. So it's important, I guess, for all of us to understand that companies right now are not just, valuing stuff or using monetary values. There are this stuff that actually can increase the value of the stock, and these are, if you are actually paying attention on the ESG, environment, society, and governance. And I think this is something that this is also a strategy, the way I see it, for governments. If we are working on the governance, then we can actually bringing in investment into our country. If we are taking care of our own societies, of our own environment, then we can actually bring in, big investment. I don't have to mention story, but recently Indonesia has been able to bring in a big investor because our president has been able to convince that investor that we are actually following the environmental practices. So it doesn't mean that we cannot develop without taking care of our environment. The Planetary Health actually provide the boundaries for us, right? Whether we go into the hole or beyond the boundaries. Now I'm an ambassador of Planetary Health. Now, the second question that I would love to answer: how to break the bureaucracy in the governments. somehow it's so interesting, Amelia, that after I came out of the system, so ASEAN is an intergovernmental organizations. Many people actually ask me how to break how to break the bureaucracy, how to talk to governments, because they are trying to demystify the governments, right? So I asked them the questions. What do you want? What do you want first? What do you want first? Then unless you are clear of what you want, then the governments cannot work with you. So define our objective first. I think, you know, if you're an NGO, if you're a human rights advocate, or you're an environmentalist, define your objective first. And governments are very busy with many different agenda, but I would say then find your advocate internally, but if not, find an advocate outside the government, like, you know, someone who's close to the parliament and can be the advocate for environmental justice, because the parliament actually is working for the people. So there are ways to do that, but you know, often that they're not clear of the objective. And that would be my advice. Thank you.
Thank you so much, Ibu Adelina. And also regarding ESG, Dr. Jamila, we cannot take away the fact that the involvement needs to be with communities, with governments, but also with big players, not just environmentalists, but also big companies that have the funds to help out. How do you harmonize the relationship? What advice do you have to maybe environmentalists or NGOs or governments that maybe want to harmonize relationships with big companies so that they too can get into ESG in a more harmonious way?
Okay, I'm going to try and address some of those questions and then that one, yeah?
Yeah.
And I'll try and clump the responses. So I think the questions from the gentleman here around direct relief work and response, and how do you then bring that planetary health kind of agenda together with yours? I think the first thing is to stop putting things into boxes, right? It's about how you do work. Now, I say that we are responsible. I spoke at the Humanitarian Network Partnership Week last 10 days ago, and I said perhaps we as humanitarian workers in our response have created more damage because of the stuff we do. You know, at least in this part of the world, the minute you have a crisis, you'll see tons of plastic water bottles being flown into a crisis zone, right? So it's about designing your response. Now, UNHCR has been quite successful. They have managed to build refugee camps that are green. And it doesn't mean that they go to the donor and say, this is my part on planetary health, right? But it is really about thinking through, putting that lens in front of you and how you do your work, your planning and so forth. But at the same time, we need to educate donors. So, you know, this is why, you know, I'm trying to bring the dialogue on planetary health here in the humanitarian sector and the development sector, because unless we actually tell them, if you start looking at things in a much more, you know, holistic way, that the solutions come from connecting the dots. Because as you said, you know, the biggest problem we have in our race to assist people is we divide people into parts, right? We divide them into a womb that's going to give birth, so that belongs to UNFPA. And you know, we talk about the, you know, water, sanitation and hygiene, the bowels and all that belongs to UNICEF. Then we think about, oh, their stomach, right? They need to eat. Oh, that belongs to WFP. We don't look at people holistically, and that how do they thrive in an environment where they are actually under a lot of stress, and how do we do this in a way that actually doesn't damage the planet further? We are incredible as human beings. Our capacity to innovate is limitless. Many years ago, when this wasn't even discussed, but WFP then was already discussing with Google and others about boxes that would be impregnated with seeds, so that after they deliver their goods, these boxes would be put into the ground and trees would grow. Yet in Bangladesh, in Cox's Bazar, we know that, you know, 10 football fields of forest is being cut down to make space for refugees. So we don't think, you know, we don't think through this holistic approach. So I think in what you do, build in that lens and then write about it. Show your donors the added value you brought by bringing in that planetary health angle. Health care in Africa. There are doctors in Africa working with, really liberating, solar energy and so forth for clinics that would either have would never have any energy. The issue around digital health, telemedicine. This has revolutionized. Africa was the leader with Safaricom and so forth, Daktari, where people in the most remote settings would have access to telemedicine so that midwives would know what to do and so on and so forth. So I think that short-term, long-term kind of view. And I think one of the things you said about how to engage with the private sector, how to bring it all together, I think the private sector are way ahead. We are struggling to catch up, right? Now, the private sector are bound by ESG. In many countries, including mine, you cannot get a loan if you're blacklisted on your ESG. So, if your procurement, your pipeline and all that is very carbon, you're a polluter, then it's very hard for you to get financing, for example. So there are already disincentives built in, but there's none in the aid sector. You just do what you talk. We talk about accountability, but really we're not accountable, right? So, and the poor stakeholders, or the shareholders in our case, will be people affected, have no avenue to demand. So we're worse than some of the politicians even. COP26, at least the spotlight was on the global leaders demanding them to sign up to a race to zero by 2050, to sign up to coal use and so forth. But we don't do that. So I think there's a lot we can learn. And I think for the private sector, they are willing to partner. But we, in the civil society, in the UN, in the international organization, need to learn, a little bit more about the processes, the systems that are there, because some we can actually adapt and take on. So World Economic Forum is going on right now, as you mentioned, Amelia. Usually you bring all the top guns, you talk about sustainability, it always is in winter usually, and they have this melting ice snowman in Davos, to remind people that everything is melting. Come Ukraine, the entire attention is shifted to Ukraine. Talk about shops, because there's so many things that are happening. We look at the things closest to us and we forget that actually there are crises, there are conflicts longer than Ukraine that are not even looked at or thought about. So, how do we demand this, from our leadership, that we have to look at equity worldwide, not just by region or where it's affecting them most. So I think this is the issue that is at hand.
Thank you very much, Dr. Jamila. Unfortunately, due to and respect and time management, we're going to have to close this session. But please allow me to first ask our speakers to deliver your closing statements, the anchor messages that you would like to convey to the audience. And maybe we can start from Ibu Kara.
Yes. So my message is that, we want to change minds, right? With anticipatory action, with planetary health. It's not easy. So build the evidence, translate it into something that means something, have value to at people. And I try to do that, provide that space, as I said, for future leaders to connect, inspire, and empower each other.
Thank you very much, Ibu. And Ibu Adelina.
So someone said that a woman is like a tea bag. You cannot tell how strong she is until you put her in hot water, right? Then imagine the world, there's like 8 billion of us, and half of the world, the population of the world is actually women. And you boil all of them in hot water, they're going to explode. But we don't need half of the humanity to explode. We only need a fraction of it. A fraction that will actually become not the one that follow the crowd, but the one that let the crowd follow them. So I'm not suggesting for us to develop another network or, to form, to build champions, women champion. I think we have done that quite a lot. I'm calling for a movement. I don't know how to do this, and this is just the start of conversation, and it can start with us. But what can we do? And I think we all, if we have the ticket to come to the global platform, it means that we have the privileges. Have we done enough in terms of exercising our privileges? Can we become the tea in the hot water that keeps boiling so then the others follow us?
Excellent. Thank you so much, Ibu Adelina and Dr. Jamila.
Yeah, I just realized I didn't answer her question. Yes, the answer is yes, that the curriculum is being developed. The other thing I would advise you is to maybe look at the Planetary Health Alliance website, and then you can see how you can be a partner and learn, and there are lots of tools there. Yeah. So my closing is that I think we've got to stop thinking in silos. We have to stop building strategies within our own comfort zone and step out, right? And Planetary Health offers that approach, that framework that can help to really, bring and integrate a lot of the different work streams together. It doesn't have to be only one framework. I think that each of the areas of work, everyone is very wed to their areas of work, needs to put that planetary health lens on. And I think, the take-home message for me, I hope, is that doing business as usual as we are now is not going to solve the problems we have. It's too complex at the moment. Again, human beings hold the answers, but also hold that knife that they stab into the planet and damage it. And we have to stop that damage, and we have to find the solutions. And I think this requires massive collaboration, a very different approach, a movement that will bring change. And there is already a Women for Planetary Health movement. So there are many things already in existence. I think we need everyone in this room at least to go home to think, you know what? The next time I buy something, is this good for the planet? Thank you very much.
Thank you very much. And distinguished guests, ladies and gentlemen, as our speakers have emphasized and strongly pushed the message for women's transformation, not just by women for women, but by all for all. Ladies and gentlemen, as we know, a good city needs good urban planning, and a good approach to sustainability, to planetary health approaches also need better planning and better communications. And being a feminist does not mean that we want all the attention to be focused on us. It is for us to be involved, because we want to be involved in these discussions, and we want better communication and collaborations. And ladies and gentlemen, the weaknesses, especially in current approaches to policy development and action, and in the increasingly complex of the disasters that we have faced, were all made too clear during the pandemic, and we have so much to learn from the 2 years that we have faced. And speaking of women's transformation, really the input of women and risk reduction and climate change adaptation strategies would not be possible unless you include all of us to be solving a matter together. And investing in the girls and women, ladies and gentlemen, creates a ripple effect that would have and yield multiple benefits. Remember, by investing in women, you are investing in the future generations that we hope would become the next Ibu Adelina, Dr. Jamila, as well as Ibu Kara. Ladies and gentlemen, let us give the biggest round of applause to our speakers. I am so honored to be here with you ladies. I am proud to be a woman, and let us continue to propose and support women empowerment. And thank you so much, everyone. I hope you've gained incredible insights from our speakers here today.